Today, we're breaking down one of the most powerful little glands in your body, the thyroid. You've probably heard the word thyroid thrown around in conversations about energy, weight, or hormones. But what does it really do? In this episode, we'll cover what the thyroid is, the hormones it produces, what those hormones do, how to test your thyroid, and the common problems that can happen when it goes off balance. Let's get started. What is the thyroid? The thyroid is a small, butterfly-shaped gland located at the base of your neck, just in front of your windpipe. Despite weighing only about 20 to 30 grams, it has a massive influence on your body's systems. It plays a key role in your metabolism, energy levels, growth, temperature regulation, and more. It's part of the endocrine system and works under the control of another gland in your brain called the pituitary gland, which sends signals, like the hormone TSH, to tell the thyroid when to speed up or slow down its hormone production. The thyroid produces three main hormones. 1. T3 triiodothyronine. 2. T4 thyroxine. 3. Calcitonin, 4, is the main hormone produced by the thyroid. It's essentially a storage form that travels through the bloodstream. T3 is the active form that actually does the work inside your cells. While the thyroid produces some T3 directly, most of it comes from T4 being converted into T3 in organs like the liver, kidneys, and gut. Calcitonin is a less talked about hormone that helps regulate calcium levels in the blood. What do these hormones do? T3 and T4 are like the managers of your body's metabolism. They influence almost every organ and tissue. Here's what they help control: how fast your body burns calories, your metabolic rate, your heart rate and blood pressure, body temperature regulation, mental clarity and mood, digestion and bowel function, menstrual cycles and fertility, cholesterol levels, growth and development, especially in children. When these hormones are out of balance, the effects can be widespread, from fatigue and weight gain to anxiety, heart problems, or memory issues. Calcitonin, while not as central, helps regulate calcium by lowering it when levels are too high. It also plays a minor role in bone health, especially in women at risk for osteoporosis. How do you test the thyroid? If you or your doctor suspect something's wrong with your thyroid, a few blood tests can give a clear picture. The main ones include TSH, thyroid-stimulating hormone, often the first test done. If it's high, your thyroid might be underactive. If it's low, it could be overactive. Free T4 measures the unbound, active thyroxine in your blood. Free T3, less commonly tested but useful in hyperthyroidism or when TSH and T4 are unclear. Thyroid antibodies. These include anti-TPO and anti-thyroglobulin antibodies. They can reveal autoimmune thyroid diseases like Hashimoto's or Graves', sometimes even before symptoms appear. Reverse T3. In rare cases, this helps evaluate thyroid resistance, especially in chronic illness or extreme stress. Thyroglobulin and calcitonin, used mainly in thyroid cancer monitoring. In some cases, your doctor may also recommend a thyroid ultrasound or a radioactive iodine uptake scan to evaluate the size, structure, and activity of the gland. It's also worth noting, thyroid screening is standard in newborns to catch congenital hypothyroidism. Women trying to conceive or those with irregular menstrual cycles are often tested, as thyroid issues can affect fertility. What are common thyroid problems? There are several types of thyroid dysfunction. Some are mild and easily managed. Others can be more serious if left untreated. 1. Hypothyroidism, underactive thyroid. This means your thyroid isn't producing enough hormones. Symptoms include fatigue, weight gain, cold intolerance, dry skin, hair thinning, depression, and brain fog. The most common cause is Hashimoto's thyroiditis, an autoimmune disease where the immune system attacks the thyroid. Hypothyroidism is especially important to monitor during pregnancy, as it can impact fetal development and increase the risk of miscarriage. 2. Hyperthyroidism, overactive thyroid. This happens when your thyroid produces too much hormone. Common symptoms include weight loss, anxiety, irritability, rapid heartbeat, tremors, heat intolerance, and excessive sweating. The most common cause is Graves' disease, another autoimmune disorder. It can also cause exophthalmos, or bulging of the eyes. Hyperthyroidism can increase the risk of osteoporosis and heart rhythm disorders like atrial fibrillation. A milder form of both of them is referred to as subclinical. Subclinical hypothyroidism is when TSH is elevated, but T3 and T4 are normal. Symptoms may be mild or absent, though some people feel tired or gain weight. It's more common in women and older adults and can progress to full hypothyroidism. Subclinical hyperthyroidism is the opposite. TSH is low, but T3 and T4 are normal. It usually causes no symptoms, but can increase the risk of heart issues and bone loss, especially in older adults. Treatment decisions depend on age, symptoms, and risk factors. 3. Goiter, enlarged thyroid. A goiter is simply an enlarged thyroid gland. It can occur in both hypothyroidism and hyperthyroidism. Causes include iodine deficiency, autoimmune disease, or nodules within the gland. In some cases, a large goiter can cause visible swelling in the neck and may interfere with swallowing or breathing. 4. Thyroid nodules. These are lumps or growths in the thyroid gland. About 95% of thyroid nodules are benign, but some require a biopsy to rule out cancer. Features like irregular borders, microcalcifications, or fast growth on ultrasound can be concerning. 5. Thyroid cancer. This is less common but usually very treatable if caught early. The most common types are papillary and follicular thyroid cancer, which grow slowly. Less common types like medullary or anaplastic thyroid cancer are more aggressive. Thyroid cancer is often detected as a painless lump in the neck during a routine exam. A few extra points that are often overlooked. Nutrients matter. Your thyroid needs iodine, selenium, zinc, iron, and vitamin D to function properly. Both deficiency and excess iodine can cause thyroid dysfunction. Chronic stress, poor sleep, and illnesses can block the conversion of T4 to T3 and mimic thyroid symptoms. Certain medications like lithium or amiodarone can interfere with thyroid function. Smoking can also increase the risk of thyroid problems, especially in people with autoimmune conditions. People who should consider regular thyroid screening include women over 35, anyone with a family history of thyroid disease, those with autoimmune disorders, like type 1 diabetes or celiac disease, pregnant women or those planning to conceive. Your thyroid may be small, but it has a huge say in how your body runs. When it's off, even slightly, you can feel it in your energy, mood, weight, skin, hair, heart, and even your bones. Thankfully, most thyroid conditions are treatable and manageable once they're identified. So if you've been feeling a bit off lately, talk to your doctor and consider getting your thyroid checked. It's one simple step toward better energy, better focus, and better health overall. Thanks for tuning in. Don't forget to subscribe for more clear, science-backed health content. See you in the next one. You in.